Hi there. Thanks for joining me. Um, I am going to talk today a little bit about what I was doing in Washington, D.C. at the Integrative Health and Wellness Caucus. Can you tell I moved? So sorry about the mess behind me. We're in the process. We just moved into a new house and things are still chaotic, and I'm still traveling and working. So anyway, it's fine. It is what it is, and I'll get it straightened out eventually. Okay, so today's topic is about the Integrative Health and Wellness Caucus that I attended yesterday in Washington, D.C. It was hosted by a group called the called the Integrative Health Policy Consortium, which is a group, it's an interprofessional group. So that means there are acupuncturists, chiropractors, massage therapists, craniosacral therapists, people doing reflexology, Reiki, yoga therapy, chiropractic, acupuncture. I think I mentioned all this. So what's happened with Congress, what I found out yesterday is that many individual groups have approached Congress. So it's like the chiropractors have approached them, like, how can we fit into healthcare? The acupuncturists, these different groups. But what's great about the Integrative Health Policy Consortium is that they're bringing all of the different modalities together. So it's really kind of a yoking of the different integrative health people to be more of a force, more of a force for change in Washington. There's a couple of interesting points that I thought I would share today. One is that it may seem surprising, but many people still don't know what integrative health means. And there's also integrative medicine, which is different than integrative health, right? Like I would consider myself an integrative health provider, not an integrative medicine person. Integrative medicine typically is facilitated by physicians. And yesterday there were people there from the American, I'm going to get the name wrong, but it was the American Physician Acupuncturist group. They were there. So there's this barrier because people don't know what integrative health is. And then specifically when we're talking about yoga, even more of a barrier. So yesterday I was in a room in the Rayburn building at the Capitol. And there were probably about 10 of us, 8 or 10 of us all together, different practitioners, all sorts of different people were there doing their practices. And then the congressional members and the staff would come. I think we maybe only treated 1 or 2 actual members of Congress, but we had a lot of their staff come in. And we had people like from the Labor and Education Committee come in, different people that work on the Hill. So people would come into the room and they would get, some of them had signed up, but they would get like an acupuncture treatment or a massage but when I would say, would you like to try some yoga therapy? A lot of people would go, look what I'm wearing. I can't do yoga, or no, I don't want to do yoga. So I started, because I'm always looking for the right language, I started saying things like, would you like to do some mind-body therapies? Or would you be interested in learning some stretches for neck and shoulder pain or some stretches for low back pain? And that was so much gentler for people. It's a big, as I say all the time, we have this huge, huge PR problem in yoga because people conflate fitness, they go, Pilates, Zumba, Tabata, yoga. They lump it all together because they see it at their gym. They have a real hard time understanding what yoga therapy is, or therapeutic approaches to yoga, or slow mindful yoga. So, we have to have a diverse lexicon to be able to explain these practices. We have to be very versatile into being able to say, so would you like to try some mind-body practices today? That worked, So I had I worked with a lot of really interesting, diverse people. It wasn't just, middle-class white women. I worked with many diverse people, a lot of men actually, and some young men. I had some people of color come in and work with me. So it felt really good to have that kind of diversity. And everybody was in their business clothes. And we did some very gentle protocols. Actually, I'll show you what I gave. And then I would give out these handouts. So what I gave was, this is my lower back therapy handout. And by the way, I'm going to figure out a way to share this with all of you, not today, but it'll like be somewhere in one of my emails. So I gave them like a lower back therapy protocol, if you want to say. And I didn't even call, look, I didn't even call it, I didn't call it low back pain. I called it low back wellness. And then I had another one, because this is what they asked me to do. They wanted very simple protocols. So this is how I put it together, the Integrative Health Policy Consortium. And then this was my other one for neck and shoulder wellness. So I gave that, I would hand out these handouts. I would show them how to do the little routine and say, you can go home and do this yourself. You can teach it in your office. You know, you can do it at work, as a way to sort of start building some more of that lifestyle, you know, yoga lifestyle into their routine. And also the idea was to wake them up a little bit to this idea. And so I would talk, you know, about how yoga is scalable. It's available, and you know, you can provide it in small groups. It's low risk. It's low cost. You know, I would give them a little spiel too. So I had really great responses, and together it felt really good to be together with lots of integrative practitioners who are not sort of vying for the little tiny sliver of the pie, but actually working all together to like push healthcare in a different direction. So that part of it was really exciting to me. So a couple of other things I wanted to share. One is that the name of the caucus I went to yesterday is a Congressional Integrative Health and Wellness Caucus. And these two representatives, Judy Chu and Jackie Walorski. Judy is Democrat, Jackie Walorski is a Republican. They're the founding members of this caucus, and they're the one trying to get more representatives. So what you can do if you live in the States is write to your representative and say, hey, I want you to join the Integrative Health and Wellness Caucus. I want you to become a member of it, because if you do, then you're going to be helping to improve healthcare. Now, the big focus of yesterday was chronic pain. And what we know is that 75% of addictions, opioid addictions, start with a pain prescription, right? So we have this huge opioid crisis right now. We don't have viable solutions for pain, and integrative health, integrative modalities offer some really great viable solutions. So that was one of the things we were working on yesterday, is promoting this idea that we have some really great and low risk, you know, affordable modalities that can be helpful for addressing chronic pain. So that was one of the things we were going for. The other big issue I want to talk about is yoga therapy, because acupuncturists, chiropractors, massage therapists all have licensure, and yoga therapists do not have licensure. So it's no wonder that yoga becomes classified as a fitness activity, right? It makes perfect sense that it gets thrown into that category, because they got to put it somewhere. And it does. So it's more in the wellness lifestyle stuff, less in the therapy stuff. So one of the things that I have been discussing with the people at the Integrative Health Policy Consortium is the idea of, because what I've been doing for 10 years is training healthcare providers in mind-body modalities. So training healthcare providers in how to integrate yoga, therapeutic yoga practices into their clinical practice. And the policy consortium people really agree that this is, you know, the way we have to go right now until we have licensure for yoga therapists. And even when we have a licensure for yoga therapists, we're still just at the beginning of this massive mountain that we have to climb in terms of getting that profession, awareness about that profession, and bringing that profession to the forefront, the way acupuncture, the way massage, the way chiropractic have come forward. So they're 20 years ahead of us, really. You know, we still have a lot of work to do in the yoga therapy world. And there's only about, I don't know, something like 4,000 yoga therapists in the world. That, I don't know if it's in the world, but that belong to IYT. So, you know, it's for me, I feel like we have to move a little bit faster, and that we can bring mind-body practices into other professions. You know, the way that acupuncture has come into medicine, I think that's something we can do with yoga therapy in the short term until we're working towards that profession. So that's one of the things that I'm really committed to and trying to help. Okay, so let's see. I want to tell you one more thing before I go. Sorry, this has kind of been a long one. One more thing I want to say before I go is that I learned, it was really interesting. I'm going to blog about my experiences, so I'll write more if you want to hear a little bit more. But there's also another caucus, and this is the one I'm really interested in right now, and I hope I can sneak in the door for that one too. It's called the Health Innovation Caucus, and typically health innovation is conceptualized as like different apps you can use for health, or technology kind of stuff, innovation, right? So they think about it as technology stuff. So I think that yoga is the inner technology, right? I think this stuff, our computers and stuff, that's the external technology, and I think the inner technology also needs to be we need to become more aware of it. I think the heart math people have been really good at that, and like helping people. They mix inner and outer technology, like use your breath to shift your breathing rate, which then will shift your heart rate and bring you into more parasympathetic homeostasis. They've been really good at that. I think as yogis, we can talk about inner and outer technology and the bridge between the two. I think we have to embrace this bridge. There are apps that I was listening to NPR yesterday, and they were talking about, and this is how they pronounced it, the Asana Rebel app that you can get for your phone. That's like a fitness app. Can you at least pronounce it properly? But there's going to be apps. There are going to be technologies that are helping people to regulate their nervous system, undoubtedly. So it's great if you can do it without technology, but I also think being able to walk that bridge across will help us to get more traction in this health innovation field, which is sort of rising, important field, health innovation. And the reason it's important is because of the abysmal outcomes, right? So we have, I think our bill last year was 3.4 trillion in healthcare expenditure, 87 to 90% of that going to chronic diseases, which are largely preventable. We take away money every year from prevention. If you spend $1 on prevention, you save $5.60 on treatment. So there's so many reasons that it would make sense. Where it makes sense to be more proactive in terms of health innovation, in terms of making changes, to the system. And I think yoga actually, strangely enough, I think it fits really well with this idea of health innovation. So 2 caucuses, Congressional Integrative Health and Wellness Caucus and the Congressional Health Innovation Caucus. I think that's where we should be focusing our attention. However you want to get involved, call your representatives, tell them to join the caucuses. That's one great thing you can do. And then we just keep pushing this juggernaut. We keep pushing it and trying to change the trajectory of health in this country, and try and get some better health outcomes, and get these practices that are, as I always say, simple, low cost, low risk, person-centered, get these practices to more people. That's what we really need to do now. I want to thank you for being here. Please leave a comment or a question. I will get to them, and I'll see you next week. Namaste. And maybe the box will be gone. I don't know. Probably not, but thanks for being here.